I'm Glenn McCulloch. I'm a retired neurosurgeon, currently the President of the NeuroSurgical Research Foundation.
Hi Glenn, can you tell us what first sparked your interest in medicine?
My first interest arose as a high school student. There was a motor vehicle accident out the front of the high school which I was attending, which involved one of my classmates. He was knocked off his motorcycle by a car and suffered a head injury. And the local general practitioner came and examined him at the roadside and said, "He'll be all right," which really amazed me because he was unconscious. And indeed he was all right. Came back to school a few weeks later.
And what made you decide to pursue neurosurgery as a career?
I was very impressed as a medical student working with Donald Simpson and Jim Denning, who are the two founders of the Neurosurgical Research Foundation. As fifth-year medical students, we had a 3-week attachment, a 2-week attachment to the neurosurgical unit, and I was very impressed with their diagnostic ability, their full and very detailed clinical history, and their operative skills. So that was really the first thing that stimulated my interest in neurosurgery.
How many years did it take to train to become a neurosurgeon?
It takes about 7 years, and that's about how long it took me.
You've mentioned a couple already, but did you have any other standout teachers or mentors along the way?
Well, there was, as I said, Jim Denning and Donald Simpson, but there was also a man I worked with in the United States when I was working there in general surgery. I spent again some time on neurosurgery, and he was not an academic and not particularly famous throughout the world, but he was a very conscientious, very capable surgeon, and I was very impressed with him, a chap called Dr. Erickson.
After studying medicine, where did you train in neurosurgery?
I did most of my training in Edinburgh, in Scotland, but also did a little bit of training in Australia, in Hobart.
And how did you find that experience training and working overseas?
Working overseas is quite different to working in Australia. What I found was that in the United States, the doctors there relied very heavily on sophisticated clinical diagnostic tests like radiology, whereas in Britain there was a much greater emphasis on the clinical examination, and in Australia it was really a mixture of the two.
And when did you return to Adelaide?
I came back to Adelaide, I think it was 1974.
And what were your particular subspecialties or areas of interest?
I didn't have any particular subspecialty. I would describe myself as having been a general neurosurgeon.
And in Adelaide, where did you operate?
Most of my public hospital work was done at the Queen Elizabeth Hospital, but in later years, Women's and Children's Hospital and a little bit at the Royal Adelaide, and private work primarily at Ashford Hospital.
Can you give us an example of an average day?
An average day would be on the road by 7 or maybe 7:30, seeing private patients post-operatively in the private wards, at the public hospital by 8:30 or 9, perhaps outpatient clinic or theatre in the morning and maybe in the afternoon, and similarly at the private hospitals, and consulting the rooms probably 3 or 4 days per week.
What's the average number of hours you ever worked in 1 week?
An average week would probably be about 70 hours per week approximately, when you consider all-time post-operative ward rounds on weekends, emergency work, around about that time.
What was your first neurosurgical operation on a real patient?
Oh, I remember that very clearly. It was a carpal tunnel syndrome, and I actually even remember the patient's name because he was a German patient, and just by chance he happened to have a German name that was a very famous name in the neurological literature. I can't of course say what it was, but I certainly remember him.
What was the longest surgery you ever performed?
I think the longest was probably one particular case with a very difficult tumour at the back part of the brain, and it actually took a total of about 24 hours, but not in continuous time. We actually took a break and let the patient recover for a week, and then came back and reoperated a second time. So there was 2 operations of 12 hours duration.
And would you say that was the most complex surgery that you ever performed?
Yes, probably was.
And what was the most common surgery that you performed?
The most common surgery in general is operations on the lumbar spine for degeneration, disc ruptures, that type of thing.
And do you have any idea at all about what you would estimate the total number of surgeries that you performed was?
I did actually work this out once, as I was asked in court regarding my experience, and I answered at that time that I'd done about 5,000 lumbar spine operations, but that wasn't total number of operations. So the total number of operations is probably about double that, about 10,000 would be my guess.
What do you estimate was the most surgeries that you ever performed in one day?
It was probably in the order of 6 or 8, something like that, which is a bit deceiving because some operations can be quite short. So, for example, a carpal tunnel or another operation on a peripheral nerve may only take half an hour or so. If you considered spinal operations, probably the most would be 4 or maybe 5 in a day. But a major cranial operation may take basically all day, so it might only be 1.
What is one of your fondest memories of your neurosurgical career?
I think probably my fondest memory is the gratitude of patients in the public hospital system, and it always struck me as strange that the patients who were most grateful were often the ones for whom you'd done the least, and the ones for whom you'd done the most basically expected that to be the case.
And what were some of the biggest challenges you found?
I think although there are a lot of technical challenges of how to do operations, I think probably the biggest challenge is deciding what the best treatment for this particular patient is, and sometimes the best treatment is not surgery.
You've been an NRF board member since 2010 and currently NRF President. Can you tell us a bit about that and how you came to join the NRF?
One of the previous presidents, Brian North, a retired neurosurgeon, asked me to join some 10 or 12 years ago. In fact, I think I put it more strongly than that. I think he actually ordered me to join the board.
What would you say is the value of the Neurosurgical Research Foundation?
I think the greatest value is that it encourages research, particularly amongst young people, not only neurosurgical trainees, but lab workers, scientists. I think that's the greatest benefit of the NRF.
How do you think neurosurgery has evolved over the years, and what do you see as some of the biggest changes since you practiced?
I think the biggest changes in general in neurosurgery has been the increased ability for specific diagnosis by radiological means, such as CT scans, MRI scans, and a whole host of other investigations. I think the biggest challenges in the future is to use this technology but still have a sympathetic ear for the patient's concerns.
What advice would you give to a student interested in pursuing neurosurgery?
I could be a bit trite and say, get some sense and don't do it. But if they really are interested, I think they need to spend some time attached to a neurosurgical unit as a student and see if it really is for them, if the type of conditions treated, the surgical procedures, the length of time of study, and the emotional aspect of it is appropriate for them.
Are there any aspects of neurosurgery that you wish there was more awareness around?
It often surprised me that people think that in some way neurosurgeons are some sort of psychiatrist. So I think it would be useful for more people to be aware of what conditions neurosurgeons treat.
How are you keeping yourself busy these days?
Well, I contribute a little bit to the NRF, but I'm also involved in some other volunteer work for medical organisations, the College of Surgeons and the Neurosurgical Society of Australasia. Then I have my dog and our garden and travelling.
Have you been anywhere recently?
No, but I'm going very shortly, I hope, to the Kimberley coast.
Do you have a quirky or interesting fact about the brain or neurosurgery?
I've recently edited a book on the history of neurosurgery in Australia and New Zealand, and one of the characters that intrigued me was a man called Samuel Payton, who was on the First Fleet. He was a convict. Unfortunately, Samuel, within the first few weeks of being in Australia, was foolish enough to break into an officer's tent and steal some food. The officers thoroughly beat him up. The surgeon treated him appropriately for his head injuries and he recovered, but very unfortunately Samuel Payton was hanged 3 weeks later for his crimes.
Thank you for your time today, Glenn. We really appreciate it.